But good afternoon. My name is Katie Hubbard. I'm the Wellness Coordinator for University of Michigan Health Plans. Today, we're excited to offer a unique opportunity to get your pharmacy-related questions answered by our own clinical pharmacist, Nicholas House. Today's Ask the Pharmacist webinar comes during National Influenza Vaccination Week. So we're excited to be able to learn more about that topic and others related to medications and preventive health. Nicholas House earned his doctorate from Ferris State University. He previously worked as a staff pharmacist for Rite Aid for several years and is also certified in administering vaccinations. And Nicholas has been employed with the health plan since 2020. So today we're going to talk a little bit about medications, immunizations, and preventive health, and then answer any of your questions as well that you have for our pharmacist here. We do have a few questions that were submitted ahead of time through the registration, so we're going to address those as well. But feel free to type your questions at any time. We'll be compiling those. The ones that are for Nicholas specifically related to the presentation, he may be able to address during the slides, but otherwise we will save all of those questions for the end and then kind of tackle them one at a time as best we can. We are so grateful to Nick for his willingness to share with us and answer your questions. So without further ado, I'm going to go ahead and turn it over to him.
Thank you. Hi, everyone. My name is Nicholas House, and I'm going to share my screen here. Okay, can we see it? Cool. All right, welcome to Ask the Pharmacist, your chance to ask a pharmacist about immunizations, medications, and more. Katie already went over some background about me, so we will jump right into talking about preventative health. So I wanted to highlight some services that you may not be aware of that health plans offer. Specifically at Health Plan, we provide in-network pharmacy benefits with no cost sharing, meaning a $0 copay, for prescriptions and over-the-counter medications used in preventative screening procedures and the prevention of certain conditions. Here is a little snippet of our preventative policy that we have posted on our webpage. I have a link to that below. Katie has said that afterwards she will post the link to this as well. So what's covered? We cover some cardiovascular health medications such as statins used to lower cholesterol for patients age 40 through 70 and colorectal cancer prevention, like bowel preps for colonoscopies, patients ages 45 through 75. We also cover HIV prevention, prediabetes, tobacco cessation, children's oral health medications such as fluorides. Here is a link to those services. Oh, excuse me for a second, I have to sneeze. Sorry about that. The link here is for healthcare.gov, where they go over preventative health services that are provided by health plans to members in ACA eligible plans, such as Health Plan. I'd also like to go over some women's preventative health measures that we cover. If you're eligible, we cover medications for breast cancer prevention, preeclampsia for patients who are pregnant, vitamins and supplements for patients who are pregnant, like folic acid. And we cover certain contraceptives. So a few oral medications, patches, rings, gels, injectables, IUDs, and OTCs. If you look on our website, you can find our formulary, and anything with the letters ACA written next to it, you will know are covered at no cost share. So that's how you can tell which contraceptives we have, because there are tons and not all of them are actually ACA eligible. And it should be noted, if you don't have Health Plan, these meds will differ plan to plan, which ones they choose. So be sure to check with your insurer which medications they cover. As part of the preventative services, vaccines are covered, preventative vaccines anyways. There are 18 that the CDC recommends and that ACA requires us cover at $0 copay. These are covered at any in-network retail pharmacy that participates in our network, which is a lot of them. I've listed out the examples here, and you'll notice some color coding. These are examples of medications that are available in combination vaccines. So Tdap is tetanus, diphtheria, and pertussis. MMR is measles, mumps, and rubella. And Twinrix is hepatitis A and hepatitis B. There are quite a few more combinations that are available too. I just wanted to list some of the more popular ones. Just so you know, you don't actually have to get 18 shots to get all of these vaccines, which is kind of nice. And as Katie mentioned, it is National Influenza Vaccination Week. It's December 2nd through the 6th. It serves as an annual reminder to everyone 6 months and older to get a seasonal flu vaccine. I also like to point out to patients that it is safe to receive multiple vaccines at the same time, depending on the type of vaccine. That's something you can discuss with your pharmacist or physician. Whoever is administering the vaccine to you will know which ones you can combine. Some common combinations, or as the CDC likes to refer to it, bundling, that you can do are flu and COVID, flu and pneumonia and COVID, Tdap and HPV. There's other examples as well. And again, that's something you would have to have a conversation with whoever is immunizing you to see which ones are appropriate to combine or bundle. And I wanted to go over quickly how that is determined. So the CDC puts out these vaccine schedules, and these are actually available to the public. The link to it is on this slide, and Katie will share that as well. So you can go out and look at these yourself to determine what you think you're eligible for, and then start a conversation with your physician or pharmacist to see if you are eligible and should be administered these vaccines. We can go over my profile as a quick example here. So I am 29 years old. I would follow in this category here. And you just go down the line to see what you're eligible for based on the recommendations up here. So anything in yellow is recommended for anyone in that age range. Purple is if you have certain indications, and blue is if you have certain indications that you and your either physician or pharmacist talk about and determine is appropriate for you. So going down the list, I have already had my COVID shot, which I got at the same time as my flu shot this year in September. So I meet both of these. I do not have a solid organ transplant. The live attenuated influenza shot is just another way to get your flu shot. So if you've had this one, you don't need this one. RSV, I am not pregnant, so I don't need that. And Tdap, I am not pregnant, have no wounds, and I did get one within the last 10 years, so I don't need that. MMR, I received 2 doses when I was younger, so we're good there. Varicella is also known as chickenpox, and I actually had chickenpox as a child, so 90% of patients who have had chickenpox do not need to get the chickenpox vaccine if they have immunity to it. You can have a test called a titer drawn, where they draw blood and determine if you have enough antibodies to have immunity to whatever it is they're looking for, in this case, varicella. And I had a titer drawn, and I don't need it. If you were to keep scrolling down, there are more listed like pneumonia, shingles, HPV, which I am not old enough for pneumonia or shingles yet, and I have had all 3 of my HPV doses when I was in college. So I am currently up to date on all my vaccines, which I had to double check that before coming here to make sure, because that wouldn't look good. But this is just a great starting point for you to have this conversation with a physician or pharmacist and determine if you're up to date or what you need to have administered to get up to date. So after that little bit of information, we'll now go into the questions and answers portion. So Katie, do we have any questions yet?
Yeah. So I'm going to kick it off with just some to follow up on some of the information that you just shared, because that was really helpful. If we're unsure about which immunizations our child has or has not received, or we'd like to kind of look up to see what they've gotten so far, Is there an easy way to be able to do that? I've heard of Micker, but I'm not sure if that's accessible to parents.
Maker is accessible to anyone, actually. You would have to sign up for a profile through the state of Michigan, and it's actually like the same website you would sign up for to renew a driver's license subscription. So you can get that profile that way. If you don't want to go through that, most doctors will have access to it in their office, and you can request a printout. And most pharmacies also have access to it and can give you a printout of your vaccine schedule.
I'm gonna switch gears a little bit. This was one that was asked by someone else. What should I do if I miss a dose of my medication? And I know this is a really broad, so you can speak to it however you want, but what to do if you miss a dose?
So that actually varies based on what medication you're taking, how long it's been since you've missed it, what the dosing is for it. Um, so I would recommend taking it on a case-by-case basis. Generally, if you missed one and you don't have one coming up shortly, you could just take it at that point. If you have concerns, you can reach out to your pharmacist or physician to make sure. Also, most medications have what's called a package insert available, where that is a section that's in there where it specifically addresses what to do if you miss a dose of this medication. That isn't given out with every prescription, but you can request it from the pharmacy. And it's a great thing to have when you start a new medication because it has a lot of details in there about that medication, what to expect in terms of side effects and storage, and then information like what to do if you miss a dose.
Awesome, thank you. This was one that was submitted ahead of time. Any recommendation on where patients would be able to get a pharmacist review of medications for contraindications of medications to each other if the patient was on a lot of them?
Absolutely. So most community pharmacies like Walmart, Meijer, Walgreens, or Sparrow's Pharmacy Plus will have pharmacists available to meet with you to do what's called an MTM, or Medication Therapy Management. As part of that, you can request a CMR, or Comprehensive Medication Review. And during that, you will sit down with the pharmacist, provide them a list of all the prescription medications you take, all the over-the-counter medications you take, and that includes vitamins and supplements. And then any disease states that you're aware of that you're currently being treated for, or conditions that you've had in the past. They will take that information. They can run a screen on the drugs to see if there's any interactions between them, and they can provide you recommendations for alternative medications to take, maybe address some concerns you're having with side effects during that as well. Again, it's just the opportunity for you to have that conversation with your pharmacist and ask those questions. But that's a great question and something that you should definitely look into with your local pharmacist.
So true. If there are other questions, feel free to type those at any time in the chat. I'm just going to keep rolling right along here. Why should I get the flu shot when I've gotten it before? So that is one that I know you probably hear a lot.
It is. It's a very common question and a valid concern. Viruses are living things and they grow and they mutate. So each year, the flu virus from the previous year kind of learns what humans are becoming immune to and finds new ways to get in there and infect you. So these new strains, as they're called, of influenza need new vaccines each year to treat them. So every year, the CDC has this very difficult task of trying to predict, based on this year's flu vaccine and the viruses that were found, what strains are going to be dominant in the next season. And then they put together a vaccine with those in it. It's very hard to cover everything. Usually they only cover 3 to 4 of the strains. So they have to try and predict which ones are going to be most common. And that's actually, if you hear the terms trivalent or quadrivalent vaccine, that means there are 3 strains in the trivalent or 4 in the quadrivalent. And you can actually ask your pharmacist each year what the strains are for that particular year, if that means anything to you. Interestingly enough, one of them last year was named after Michigan because that's where it was discovered. So go us. We have our own flu.
I love it. If I am picking up a prescription from the pharmacy and I'm used to seeing blue pills, and this time when I pick it up, they're white pills, should I be concerned?
Not necessarily concerned, but it could be a chance for you to ask the question just in case something happened. It is very common, though, that pharmacies will pick different manufacturers of the same product, and those manufacturers will have different looking products. So let's think about atorvastatin, which is a cholesterol medication, for example. Most of them are going to be white, but occasionally you'll find some that are cream colored or blue colored. And that's just because different manufacturers make them and put different dyes into them, sometimes different shapes, sometimes different, well, always there's going to be a different stamp on it so you can identify who makes it. But if you notice it's different from last time, it's probably just the manufacturer, but you can still ask your pharmacist to make sure, and they can let you know, yes, this is the same product made by someone else, or maybe you caught something.
Thank you. There's a question in the chat, and I'm going to read it here. I'm 70 years old with some health issues. The pharmacist stated that I could, if I wanted, get the COVID vaccine every 2 months to be very protected. Isn't this a bit excessive?
So it would depend on what the health issues are, but that's definitely something you would want to discuss with your pharmacist and physician to make sure that's appropriate for what your condition is. People who are immune compromised do not build up immunity the same way to vaccines that someone who does not have immune compromisation. So if you aren't able to build up enough antibodies in an appropriate amount of time before the vaccine is kind of digested by your body, you may need multiple doses to get to the same level that you would if you were immune competent.
Thank you.
Mm-hmm.
I know a lot of us are looking for ways to save money a little bit. And so with all of the generic drugs out there, medications out there, do you find that there's a significant treatment effect of brand name medications versus their generic alternative? Is there any preference given to one over the other?
Typically, preference will be given to generics because they are cheaper. They're in greater supply because multiple manufacturers can make the same product when they are generic. Because they're cheaper, it means you'll usually have lower copays for it. It means the pharmacies can get them cheaper. So it's economically better. In terms of actual treatment differences, the FDA allows a 20% variance, either greater or more, compared to the original strength to get approval for a generic medication. So sometimes you might notice, and this is more with drugs with like very particular doses. So like think anything with like a 0.1 milligram dose. You'll notice a significant difference with a 20% lower or 20% higher dose than you would with something like metformin 1,000 milligrams. You're not really going to notice a whole lot either way there. That 20% is just a tolerance. Most generics do not come close to that. Most are in like the 5% range back or forth. But yes, there can be treatment differences.
It's interesting.
Yeah.
Does it matter what time of day that someone takes their medications? If you're supposed to take something twice a day, or even once a day, does time of day matter?
Yes, it does for certain medications, all depending on how they're metabolized, when you actually want them to be taking effect, and the question about if you have to take them twice a day, does it matter what time? There are two different ways that a physician or prescriber will send to a pharmacy to put dosing on a bottle. One can be twice daily, and if you see twice daily, it just means take them 2 times a day, not right next to each other, but you could do like breakfast and dinner. Or if they very specifically want them separated by a certain amount of time, they could say every 12 hours, in which case you'd have to take it at, say, 8 a.m. and 8 p.m. And that's to say you don't want higher concentrations in the evening if you were to take it at 8 a.m. and 5 p.m. So it is important to note the time of day that you take medications. If they don't specifically tell you, your physician, or if it's not specifically written on the bottle, then it's not as big of a concern.
Thank you. This was one that was pre-submitted ahead of time. Wondering about medications interacting as far as dementia goes, if there are certain contraindications that this person should be aware of. I'm guessing it's for a loved one, or special considerations that you would like to share.
That is a great question. Yes, there are quite a few considerations you have to take into account for in elderly patients and especially in patients with dementia. There are a lot of drugs that we have that affect chemical balances in the brain, and patients with dementia are already having issues with those balances. So adding drugs on top of it can really make the symptoms of dementia worse, and we want to avoid those. And then elderly patients, I think like patients above the age of 60, 65, they start to also have some they're not really issues at this point with chemical imbalances, but more sensitivity to those chemicals in the brain. And we actually have a list of medications that's created called the Beers Criteria List. It was created by a physician named Mark Beers out of California in like the 90s. And that is maintained every 3 years by the American Geriatrics Society or Association, one of those. And they update it to include all drugs that are not recommended for elderly patients or patients with dementia because they will affect those chemicals in the brain. Chemicals like antidepressants will affect chemicals like sertraline in the brain. Anticholinergics are especially not recommended. Those are typically used for like drying you out or like urinary issues. So, always good, especially in patients with dementia, to check on any new medications, any existing medications even, to see if they're on that list or if you have medications that are interacting with other medications that could lead to more of those chemical imbalances. It's a great question. Thank you.
Yeah, and if the person who submitted that question has follow-up questions, please feel free to type those at any point. I just want to make sure that we get your question answered, and if there was specific aspect of that you'd like to learn more about, please feel free to clarify. Oh, what to do if we go out of town and forget a medication?
So that depends on the medication. When I worked community pharmacy at Rite Aid, I worked in Petoskey, which is like a vacation destination in Michigan. And we would get at least 2 people a day coming in saying they forgot a medication. And sometimes I could assure them it's not a big deal. If you left your, say, your statin at home, your cholesterol is not going to spike through the roof this week. You will be okay. Now, let's say you left an anticoagulant at home. That would be more of a big deal, something we would need to address immediately. In those cases, we can sometimes do an emergency supply. And this is where it's nice if you go to like a chain pharmacy that is in multiple states, because if you have something filled at a Walgreens in Florida and you forget it, you can come up to Michigan and they can borrow from your next supply and give you more. Again, this is something on a case-by-case basis, only when it's appropriate. Not all pharmacists are willing to do that for all medications, but definitely something to ask if you don't know if it's urgent or a concern. Just ask a local pharmacist there to see what you should do and what your next steps should be.
Great advice. This one, I think I know the answer to it, but it is if you're taking an antibiotic and you've been prescribed, but you start feeling better after being on it for 4 or 5 days, and it's a 7 or a 10-day package, is it okay to stop taking it once you are feeling better?
That is a good question, and one that we actually get asked a lot because it doesn't really make sense to you. If you're feeling better, why do you need to keep taking this? So the answer is it starts to kill off the bacteria and you'll start to feel better as there's less of them. But the bacteria aren't all dead yet. And if you stop taking it, those bacteria that are remaining, they can learn how to survive. So they will see what you took, let's say amoxicillin. You took amoxicillin. These remaining bacteria that are still living will learn how to fight amoxicillin and they'll develop resistance to it. And then next time you get sick, amoxicillin's not going to work because these bacteria have now evolved to learn how to fight it. So that's how we get what's called antibiotic resistance or antimicrobial resistance. It's a very big health concern in the US right now. There are a lot of antibiotics that used to be very effective that are no longer as effective because of this. So it seems counterintuitive to keep taking a medication after you feel better, but it is very important to prevent future illnesses that you do.
Thank you. How do I know which over-the-counter medicines or vitamins or herbal supplements are safe and won't interact with other medications that I'm on?
So if you're currently taking prescription medications, then it is always a good idea to ask your pharmacist if they can run a interaction check between any over-the-counter medications or supplements that you're wanting to take against your prescription medications, because there are a lot that will interact and some of them can be pretty dangerous. If you're not taking any prescription medications or any over-the-counter medications, then usually they're going to be safe. That's how they get approved to be taken over the counters. They're deemed safe enough to take without having physician oversight. That's not to say that everything is going to be safe for everyone, though. There are certain disease states even that you would want to be concerned about taking certain supplements and vitamins with. So just a good thing to ask a pharmacist or a physician before starting a new product that you're not familiar with.
Yeah. When's the best time of year to get your flu vaccine?
So it's December, and this is Vaccine Awareness Month, or week, sorry. Please don't wait until December, though. The best time would be like September to early October, because flu season really hits end of October. November is when it starts, and then goes through like February to March. The vaccines have effectiveness for up to a year, but they take around 4 weeks to actually be fully effective. So if you get your vaccine in November, you might not actually be protected until December against flu. So if you get it in September before flu season starts, by the time the flu is out there circulating, you will be protected.
Thank you. If there are other questions, please feel free to include them anytime. We are winding down the questions that have been pre-submitted. So I just want to make sure that we get to questions if you have things that you are wondering about. Should my child get shots if she or he is sick?
So you can get certain shots if you're sick. However, it's generally recommended just to wait because they can make you feel worse. And you don't want that. A sick kid is just miserable for everyone, and making them feel worse is not something you typically want to do. If it is a chronic illness that isn't going to be going away in the next couple of weeks, though, it is still safe to get most vaccines. There are certain vaccines like live vaccines that you need to be much more cautious about that with though. So obviously always let your pharmacist or physician, whoever's administering the vaccine, know about any recent illnesses or ongoing illnesses so that they can determine if whichever vaccine you're getting is safe at that moment.
Thank you. This was one question that I used to get a lot when I was out in the community doing flu clinics, and it was, is there mercury in the flu vaccine?
No, there is not mercury in the flu vaccine. There used to be a component of the flu vaccine that was used as kind of like it was meant to keep it shelf stable for longer. And that was a component in mercury as well. So
Is that thimerosal?
yes,
Right.
and you will still occasionally see that, but that is not actually mercury itself. It's not, the mercury is that red liquid that you can push around. It's like a very hard, it's a cool liquid to play with. But no, that is not actually found in vaccines. Thimerosal is safe to be used.
Awesome. Oh, the HPV vaccine. Let's talk about that. Why is it recommended for teen boys?
That is a good question. So HPV is human papillomavirus, and it's recommended for anyone above the age of females above the age of 9, and I think it's males above the age of 12. But it's recommended for males because while they may not actually notice the symptoms of HPV, they can still spread it to females. So the earlier we get everyone vaccinated against it, the quicker everyone will be able to stop spreading it.
And that is the one that can be responsible for cervical cancer. Is that correct?
Yes. Yeah. A lot of people think of HPV as an STD because it is spread through sexual intercourse. And that's why they think, we don't have to give it to a 9-year-old. They're not going to be having intercourse. And that is true. But the sooner you give it to them, because they're going to eventually, then they'll be protected against it. And teenagers aren't always super conscious about getting vaccines and being protected against those things. So if as parents we get them vaccinated earlier, we can protect them in the future.
If someone is concerned that they may be having a reaction or a side effect to one of the medications that they may be taking, and they may not even be sure which one it is, what would you recommend as far as the best course of action for someone? Should they just stop taking it, or what would you suggest?
That would depend on what side effect you think you're having. Side effects can range very widely from a small itchy rash to not being able to breathe. If it's something urgent and life-threatening, call 911 immediately, let them know what medication you think is causing it, and have them tell you what to do. There is a number you can call for the Center for Disease Control, the poison control number.
Mm-hmm.
And they can also walk you through certain side effects and how to treat those. If it is more of just an irritating side effect or something you think, could be happening because of a medication, you can call your pharmacist or your physician and ask them, I'm experiencing this. Could it be because of this medication that I've been taking? And see what to do from there. Maybe there are alternatives available that you could go to. Maybe there's something you can do to treat or prevent that. Sometimes that is as easy as taking it at a different time of day. Certain medications are very stimulating. Taking those in the morning versus at night can help improve your sleep. So just a good conversation to have with your physician or pharmacist if it's not urgent and life-threatening.
Thank you again, Nicholas, for your willingness to share with us today. Thank you for all of you who submitted questions ahead of time and interacted with us for this presentation. Great information, Nicholas. Really appreciate it. Thank you all so much for joining us, and we'll see you again soon.
Thanks, everyone.